The action of nitroglycerin is associated mainly with a decrease in myocardial oxygen demand due to a decrease in preload, dilation of peripheral veins, and a decrease in blood flow to the right atrium, and afterload, decrease in total peripheral vascular resistance. Indications: relief and short-term prevention of angina attacks. Dosage and administration. Nitroglycerin is recommended to be used as prescribed by a doctor. Nitroglycerin shall be taken immediately at the first sign of an angina attack. 1 tablet of nitroglycerin is placed under the tongue and kept until completely dissolved without swallowing. The usual dose of the drug is 1 tablet under the tongue. If an angina attack is not stopped within 5 minutes, you must take another 1 tablet of nitroglycerin. In the absence of a therapeutic effect after taking 2 tablets, you must call a doctor. With frequent attacks of angina pectoris, it is advisable to use prolonged preparations of the nitroglycerin series. Contraindications: hypersensitivity to nitrates, shock, collapse, concomitant use of sildenafil, tadalafil, vardenafil, etc. Age up to 18 years. Efficacy and safety have not been established for children under 18 years of age. Special instructions. Against the background of taking nitroglycerin tablets, a significant decrease in blood pressure and the appearance of dizziness are possible with a sharp transition to a vertical position from a sitting or lying position, when drinking alcohol, exercising, and in hot weather. To nitroglycerin as well as to other organic nitrates with frequent use, addiction may develop, requiring an increase in dosage. If clarity of vision or dry mouth persists or is severe, treatment shall be discontinued. Side effects: from the side of the central nervous system, blurred vision, nitrate headache, dizziness, and a feeling of weakness, anxiety, psychotic reactions, lethargy, disorientation. From the side of the cardiovascular system, lowering blood pressure, tachycardia, rarely, especially with overdose, orthostatic collapse, cyanosis, reddening of the skin of the face. From the gastrointestinal tract, dry mouth, nausea, vomiting, abdominal pain, allergic reactions, hypothermia are possible.